Good morning, everyone. My name is Lisa Golshani, and I'm the chair of the San Fernando Valley chapter of Friends of Sheba Medical Center. It is an honor for me and Denise Noyer-Arez, our Women's Community Luncheon Committee Chair, to welcome you to today's webinar. Sheba Medical Center in Israel has been on the front line of the battle against COVID-19 from the start. Ranked as the 9th best hospital in the entire world by Newsweek, Sheba's concentration of medical expertise, cutting-edge innovation, and groundbreaking research has paved the way for pioneering strategies against this unknown virus that has created a global pandemic. Thank you so much for taking the time to be with us this morning to support Sheba Medical Center and hear firsthand how COVID-19 is affecting the learning and the health of our children. Please join me in welcoming today's moderator, Molly Soberoff, the Executive Director of Friends of Sheba Medical Center.
Thank you so much, Lisa. You and Denise are tremendous leaders, and it has been a joy for me and Rachel and Nina to work hand in hand with you on today's event. Good morning to everybody from Los Angeles, and good evening to our friends in Israel. My name is Molly Soberoff, and I am the Executive Director of Friends of Sheba Medical Center, based in Beverly Hills since 1970. On behalf of our board, our staff, and our community, thank you for joining us in today's discussion that's presented with love and a whole lot of hard work by our San Fernando Valley chapter. Donations made in association with today's event are directly supporting Sheba Medical Center's COVID-19 Emergency Fund. To make your gift today, please click the donate link in the chat. No gift is too small or too big, and we thank you for your support. Before we begin, I'd like to give a very special thank you to today's event sponsors, AIM Women's Wellness Center, Bluminous, and the law offices of Lisa S. Golshani. We would also like to take a moment to recognize Temple Aliyah as our outstanding community partner. Sheba Medical Center is the largest hospital in Israel and the entire Middle East. Founded in 1948 alongside the state of Israel, Sheba has become one of the most preeminent hospitals in the world. Today, it has 2,000 beds, 150 buildings, and treats more than 1.5 million patients every single year. 21,000 cars drive through Sheba's gates every single day. And all of this happens on one campus that's located on the outskirts of Tel Aviv. Since February, Sheba has treated 600 patients who've tested positive with COVID-19. And as we speak, Sheba is treating 40 corona patients, 7 of whom are in critical condition. In an emergency situation, Sheba has capacity to treat over 500 corona patients, which they are expecting this coming winter. Sheba's been using some of the world's most amazing advanced technologies to treat COVID patients, including telemedicine and some groundbreaking programs that can predict if a patient will take a turn for the worse before it even happens. So back to this morning. Our goal for today is simple, that in 60 minutes from now, you will have advice and tools you need to successfully help navigate your child's education and well-being during these uncertain times. And to help us impart this wisdom, we've recruited an all-star panel of experts, both in education and pediatrics. Dr. Galia Barkai, who directs the unit for pediatric infectious disease at Sheba Medical Center. She also oversees all of the telemedicine efforts. Dr. Tanya Altman, pediatrician, best-selling author, assistant clinical professor at UCLA Mattel Children's Hospital, and founder of Calabasas Pediatrics and Wellness Center. And Nick Melvoin, representative of Board District 4 on the LA Unified Board of Education, who serves proudly and so well West Los Angeles and the West San Fernando Valley. Each of our panelists are volunteering their precious time to be with us today in support of Sheba, and for that, we are so grateful to all of you. Before we turn it over to our panelists, please note that everyone will remain on mute for the duration of today's session. And if you have questions during our session, we would love to hear from you. Kindly submit them in the chat box and we'll do our best to address them all. So without further ado, I'd love to turn the floor over first to Dr. Tanya Altman.
Thank you. Sorry, it wasn't letting me unmute. Thank you so much, Molly. It's an honor to be here today speaking to all of you. You know, I was telling my nurses when I walked into the office this morning that I feel like every day now feels like Groundhog Day, right? I wake up to 50 emails on COVID-19, questions from parents and schools across the country. And it's been really interesting, but also exhausting. But as a pediatrician and someone who really devotes their entire life to helping our kids both stay physically and mentally healthy, you know, it's really been quite interesting from a scientific perspective. So backing up a little bit, I'm a pediatrician in Calabasas. I also am very active in the American Academy of Pediatrics. I serve on the executive committee of our Los Angeles board chapter. I'm also on our National School Health Committee, and I have been involved in a lot of the plans that have been coming up. Back in March when this all started, you know, I was integral in the decision to close schools down here in the Valley, my area of Los Angeles, which at the time I thought was such a daunting decision, right? I was standing there in front of the superintendent and the board and everybody saying like, it's time, we need to close the doors. And I realize back now, retrospectively, that was actually an easy decision. And now we're faced with a more challenging decision of, you know, when and how to open the school doors. And not only how to open, but how to keep them open. Because as I tell every school that I speak to, is that, you know, I don't want you to open your doors if you can't keep them open. And I think keeping them open is really going to be one of the more challenging tasks. And, you know, if you look at all of the plans that the American Academy of Pediatrics has created and the CDC has created and the local Los Angeles County and our state, you know, has created, I think we have a lot of great plans. And I think it's definitely feasible to be able to open schools safely, to keep our kids safe. But there's a lot of layers there, and it takes not only resources, it takes commitment from the schools and the community, and it takes, you know, willing participants, including the teachers, who are really the most important ones that we need to protect with all of our plans. And, you know, their health and safety has really been forefront in my mind with all of the individual plans that I've been creating for each school when I walk each school and map out exactly how the safety protocols are going to be. And so I think, you know, there's no one size fits all solution, and it really varies based on, you know, every community and what's best for each family as well. You know, I spend a lot of my days talking to families from all over about their specific situations and their health risks and how their kids learn, and if it's better for their kids to be in the classroom versus on Zoom, and what it means for their own family. Some parents do need to go back to work. Some can stay home with their kids. And so I think this is, you know, this is really so different for each family and each community involved. And that's something else that we are, you know, taking into account here. I don't want to go through all my specific protocols right now and guidelines, because I think that's going to come out in all the questions. I mean, I think this was just sort of an intro. So a little more about me. I have 3 boys, high schooler, middle schooler, and incoming kindergartner. And as you can imagine, they all learn differently. They all have different needs. And so while my older kids may be perfectly fine sitting at home, Zooming on the computer with their teachers and classmates, I really want my kindergartner to be there in person, because I think that's really important for him. I serve on several local COVID-19 task force, both for Temple Aliyah, one of your sponsors, also for Viewpoint School, where I am the school physician. And I've also been helping Las Virgenes Unified School as well with their plans and their waiver to reopen some of their youngest grades. And so that's sort of a little bit about me and what my goals are. And I'm happy to answer any questions and talk you through any points today. So thank you.
Thank you, Dr. Altman. And she's also being modest because she was our inaugural honoree in the Valley 2 years ago. Dr. Altman was honored by the San Fernando Valley chapter for her great work in the community, for her support of Israel. And we're so glad you're with us today. So absolutely. I want to turn it over to Nick, my childhood friend. Great to see you. Thanks for being with us today. And we're looking forward to hearing from you.
Yeah, well, thanks, Molly, so much for having me. And yes, it's fun how small the world is. And it's also, a great day because I kind of bookended. I just actually spoke to a group of principals, but then I have this. And then this evening, I'm speaking to the Israeli American Civics Action Committee about this. So a little bit shared that it's all happening the same day. But it's also a pleasure to be here with Dr. Altman and Dr. Barkay because while I'm a teacher by training and a lawyer, I am not a doctor, I'm not an epidemiologist, and we're really at the school district trying to rely on the advice of public health experts. And so I look forward to the conversation today. What I'll do is just give a brief kind of state of LA Unified. And I think it's important to kind of anchor in the demographics. LAUSD is the second largest district in the country behind New York. We have nearly 700,000 students from pre-K actually all the way to adult. We have about 60,000 adult students. We cover 721 square miles all throughout LA. I'm coming to you now from my district, the West Side and the West Valley. But we also, 82% of our kids are living in poverty, which I think is a surprising statistic for many people. We have nearly 18,000 homeless students in LA Unified. And again, about 82% of those 700,000 students are living in poverty. The district is 89.5% of color. And so when we think about, as I'm sure we'll get into with the Q&A, kind of the transition to distance learning and what we're thinking about the fall, the difference between where I grew up going to school, independent schools on the West Side, Curtis and Harvard Westlake is a different transition than a district where 82% of kids are living in poverty. And that really weighed on me when we made the decision to close schools. And we decided to close the district on March 13th before the city had issued a safer at home order, before the state had. It was a tough decision, but as Dr. Altman mentioned, it was easier than where we are now. And I think one of the things that I asked at the time was, it's one thing to close, but unless we're very clear about the criteria under which we would reopen, it's going to be even more difficult to reopen. But we closed with the contingency that we were going to still find ways to support students and their families. And so since March, we closed March 13th, which was a Friday, that next Wednesday, March 18th, we've actually been running the largest food bank in the country. We're serving over 600,000 meals a day throughout LA County. No questions asked. About 80% of the meals we're serving are students or their families, but about 20% are adults who are just coming to our schools for food. We also then knew that in order to get to distance learning, we had to bridge the digital divide because we estimated when we closed that at least 100,000 or so of our families didn't have access to the internet. So we have now spent nearly $100 million connecting every student in LA Unified with a device, whether that's a Chromebook, a laptop, an iPad, and a hotspot. I think one of the things, I think COVID has exacerbated a lot of existing crises, the crisis around housing, around homelessness, around food insecurity, also around digital access. And I think that we've realized that access to the internet is no longer a luxury, but a necessity. And so we spent the first few weeks really in that triage mode, making sure kids were connected. And then we had to focus on distance learning and training 30,000 educators and how to use everything from Zoom to Google Classroom to Class Dojo, how to meet the needs of students with special needs. And that was the spring, that transition, making sure we were still meeting the physical needs of students. We put up a mental health hotline that is continued to be utilized because while the orders are called safer at home, we know that there are many students for whom home is not a safe place, and finding ways to support them. We then transitioned into the summer and we had our first ever virtual online summer program. So typically, because of funding in the state, fewer than 10% of kids have access to summer school. This year we had summer school available to 100% of students. We have over 100,000 students signed up, and we have some really cool partnerships. The Chargers worked with us on a sports medicine class. The director, James Cameron, did a Titanic themed marine biology course. And we also have remediation for students who are falling behind, enrichment. And then we're looking at the fall. And if you had asked me, 3 weeks ago, I would have said that on August 18th, when our school year begins, we would have a hybrid model. But then things changed in LA. And, I think we're, again, following the advice of physical health experts, of public health experts, mental health experts, and, infection rates in LA are nearing 10%. The World Health Organization recommends not reopening if you're above 5. And we've also seen all over the world, whether that's Israel or South Korea, when schools have reopened, that they've done so with a robust testing and contact tracing regimen. And we just haven't had that in LA. And so we made the call a few weeks ago to start virtually. Actually, a few days after we made that call, the governor then made a similar call and put kind of these parameters around counties that are on the watch list. LA is still on that watch list, that will not allow schools to reopen until they're off the watch list for 14 days. But what we're looking at right now is both those regional-wide factors where we can all do our part, wear masks, stay at home, bring down those numbers, but also the testing and contact tracing that we feel is needed to support students and employees. And so we're working on actually trying to maybe set up our own regimen of testing. We're also, and I'll end here, Molly, but we're also really trying to improve distance learning, because until, we are looking at a hybrid model when it's safe to do so, but we know that there will be an online track for all families who want that. And our August 18th start will be online only. And so we're looking at that live daily instruction. How do you take attendance? How do you do small group learning? To the extent that families are breaking up into pods, which we're learning a lot about. How can we support those families, but also for the many families who don't have the resources to create their own learning pod, how do we support those families? And so those are many of the different things that we're working on, in the next few weeks before our August 18th start of what will be the most unprecedented school year to date.
Thank you so much, Nick. Dr. Burkai, last but not least, and what a beautiful segue that Nick geared up, he teed you up. We're all looking to learn from you. We're so glad that you're here today to represent Sheba. So please.
Hi, everyone. I'm so excited to be here today, and thank you for having me. Really, my name is Galia Barkai. I'm a pediatrician. I'm the head of the pediatric infectious disease in Sheba, but luckily I have 2 jobs in Sheba. One of them is treat kids with infectious disease and do that. And the other thing is that I'm in charge of the telemedicine programs in Sheba. And we've been developing several telemedicine programs through the years. But now COVID came and we had to do so many other things that we didn't do before. So Sheba was the first hospital in Israel to receive COVID-19 patients. Actually, before we had Corona in Israel, the Israeli government decided to bring 11 Israelis that were on the cruise ships, the Diamond Princess Japanese cruise ship, and they had contact with Corona patients, and we suspected that they would become positive. And we, Sheba, decided that we could take the challenge and have them in Israel. We didn't have Corona wards in hospitals, and there was people were really, really afraid of it. And as soon as people heard that Sheba is going to host these patients, people wouldn't want to come to Sheba even to give birth. So what we decided to do was to bring a facility, especially for them, who's outside of the main campus. And we built, I won't go into it now, but we developed a special model in which, for the first time, we used telemedicine tools to treat inpatients. So we entered all these patients into a facility, and we built an inflatable tent outside. It's a field hospital tent, and we put all our monitors and all the facilities we needed to take care of the people from distance. And we employed all these telemedicine tools to take care of inpatients, which was really strange. So this was the first thing we did using telemedicine devices. The second thing is that we developed a model in which we could take care of hospitalized patients, outpatients that we wanted to do home hospitalization, because we understood at the moment that patients were not going to be so sick. Most of them were going to be not so severely affected and could be treated from distance. So we used our telemedicine application to monitor them from distance and to communicate with them via video. And the third thing that we did is that we transformed almost all our outpatient clinics to video clinics. In about 1 week, we opened 120 outpatient clinics, and we transformed them to video clinics, and we switched, we performed about 750 video visits per day at the time of lockdown. And this enabled us, to be sure that patients that did not have coronavirus could continue their medical treatment, even if they cannot come to the hospital. So this was really exciting. And this was one part of the things I did, and which was really very, very intensive at the moment. But the other thing, it was to prepare the hospital for having sick children come into the wards, the corona wards, and to how to organize the other wards in order to do separation between the corona suspected patients and non-corona patients. And also, I was the one treating the first kids in the hospital with corona. So in the beginning, we hospitalized everyone. So we had them in the hospital, although I have to say that kids are not so much affected by the disease. We didn't have very severe cases of children infected with corona. We did have some in Israel, I would say 4 or 5 in Israel, but in my hospital, almost all of the kids that were hospitalized were less severely affected, but usually were hospitalized or are still hospitalized due to other reasons. So sometimes it's after trauma or other reasons when children need to be hospitalized. And we have to deal with the fact that they're corona positive. And then you have all these ethical questions. Where do you hospitalize a positive kid with a negative parent, or a mother who just gave birth to a child and she's positive? What do you do with the infant? Tanya, maybe you have some answers about how you do it yourself. The guidelines are that we should try to separate, but most women in Israel would not want to separate the mother and child, so we allow them to be together while explaining the risks, of course. So we have all kinds of ethical questions, which is more time-consuming than actually treating severely affected patients. So maybe later on I can answer some questions about what happens in Israel, what happened in Israel while they opened the schools. How do we deal with it? But I'm transferring back to you, Molly.
Great. Thank you so much, Dr. Barkai. So we'll now begin the panel discussion of today's session. And I'll go back and start with you, Nick. And we're getting a lot of burning questions about the timeline. And I know I'm throwing you a curveball because I didn't prep you for this, but we know you're good off the cuff. So what do you think to those parents that are like, how much longer, if we can say? And
yeah,
thanks.
Yeah, so I think I'll just to crystallize. So the governor outlined what is not guidance, what is basically mandates a few weeks ago, and there's kind of these threshold questions that the county has to get through before we can even have the autonomy to open our schools. And this is true for independent schools as well. And that means 14 days off the county watch list. And so the first, in terms of the timing question, and again, we're meeting, around the clock with experts and with teachers, with principals, with parents to figure out when we can reopen. Because I want to be very clear that even if we improve distance learning tenfold, there is no replacement for in-person school. Not only the academics, but the social emotional support. We know the childcare needs of our families are being exacerbated as well. So the first step would be to be off the watch list for 2 weeks. And that is a collective effort where, to the extent that we all wear masks and practice physical distancing and all that, we can reduce the threshold. There are waivers that the governor announced a few days after his guidance for elementary schools to apply to reopen. But it's tricky because it requires kind of unanimity between the district and the teachers union in order to apply. And I think, not or quite understandably, I think teachers union have concerns here. They're supposed to be thinking about the health and safety of their members. That's their job. And I don't begrudge them that, but it's harder for us to maybe apply for waivers were we to just work with parents on this if we have to get the buy-in of the teachers union. So we're working on those contingencies. But I would say that, as soon as the county gets off the watch list, we will then start our internal process to again look at that. What are those infection rates? Are they below 5%? And then also, what is our testing and contact tracing? And I'll say that we're working on kind of our own moonshot because, we are not a public health provider. And you don't think of a school district as providing, let's say, TB tests. Our job is to verify that the kids have been vaccinated, but then we run schools. But because the county and the state have been, in our opinion, in my opinion, inadequate when it comes to the availability of testing and contact tracing, we're looking at setting up our own. And so we're looking at procuring millions of tests. We're talking to a few different providers right now. We're working with our health care providers for our employees so that when we do open schools, we could do so in a phased approach where maybe we test every employee, get them back at schools for a week. Then we bring in elementary students, and then we bring in high school students and we do a phased reopening. But I think that will build confidence both in our employees and in families when we do reopen schools. And it would be my hope, Molly, that we're able to do that before the end of the semester. But again, there are these threshold questions before we can even have that decision at LA Unified where the county needs to, get its act together.
Great. Dr. Altman, I saw you were raising your hand, please.
So I just wanted to add to that, and I love everything that Nick said. I have to say that, I've been working with a lot of independent schools throughout the community and also the Las Virgenes Unified School District out here. And I have to agree with Nick. It breaks my heart just how different communities are affected differently by the pandemic. And this, disparity that we're seeing is only getting bigger and bigger. And so that, that is why we are all in this together. And, I have been working around the clock, as Nick said, we all have since April on ways to get the schools out here, to safely open. And we've been doing that with the masks and the distancing and the screening, but we also have procured our own testing and we've trained our own contact tracers because I do agree that each school needs all of that. So we were kind of set to go. And then when the governor said, you can't open because we're grouping all of LA County together, I kind of felt defeated. And maybe I even cried, but I get it. We're all in this together and, what's going on in LA does affect us out here too. And so I totally understand why he gave these mandates. And so, I've been working since then, and I've even been talking in the news about this on how all of Los Angeles, we made such progress early on with March, April, and May, and we all need to get together now to turn these numbers around so we all can open. And someone asked on the chat about, waivers. So, it is a challenging process and I don't know how public health is going to decide, but I do know that many of the schools out here, we have determined by our own testing that the numbers are lower out here. I have been running summer programs where we haven't had any cases and we've been baseline testing because, I feel that baseline testing is very important, even though it only tells you how you are that day. To me, it sets a community baseline. And that's how you're going to know, is your community, your own community, okay to open? And yes, you need to provide frequent testing for your teachers as well, because that is really the only way that you're going to ensure that things are safe and you're going to know, hey, do we need to jump in? Do we need to go to distance learning? I think the term opening schools and closing schools, even though I use it myself, it's not really that easy. Of course, schools are opening in a few weeks. They might be opening online, but they are opening. And when you look at the phased plans that many of the schools out here have, where we have, our green plan, our what is it, a red, orange, yellow, green plans, and we can flip the switch, in 1 week and go back and forth between open to hybrid to closed. And this has taken all summer with all of our teachers and our administrators, to work on. And so I do hope that the LA Public Health looks at all the data in each separate community and says, okay, we are going to allow this one district, these schools to sort of, be our guide, because I think the data that we can provide out here in the Valley is going to be very important for helping LAUSD also be able to open in this small phased approach. And maybe at some schools opening K-2 or K-3, and then seeing how we can go from there. But I think, although I understand why the decision was made, I think we're also in some ways doing our community a disservice by not allowing some schools to be the role model and provide their resources and plans to the others. So, we'll have to see what happens, but that's sort of one of the arguments that I'm making for our communities out here.
Great. I'll ask Dr. Barkai, which is really a burning question today, which is tell us a little bit about what it was like to reopen and some of the major lessons that was learned that you think we here in Los Angeles can learn from.
So in Israel also, we closed the schools quite quickly in March. And then by May, we already felt that we were in the end of the first wave, and we were really very happy about what we did. We had less and less cases, and we got information from around the world that children do not transmit that much COVID-19 coronavirus. And we got information from China and from other countries as well, that where schools were opened, children did not transmit that much from one to another. We knew that almost all the kids that were infected in families. That's actually what happens now in Israel, and especially small children were not that good. They're also less affected by the disease, but also less transmitting the disease. Sorry about my dog here. It's evening here. I'm at home already. So so we were quite. I was quite sure that it's going to be okay, and we opened schools quite quickly, although in smaller groups and in capsules, and we tried to have social distancing and children and teachers wearing masks. I have to say that it doesn't always work. And just 2 weeks after we opened, we had the first outbreak in a high school in Jerusalem, where finally we found that 150 people were infected with COVID-19 out of about 2,000, which is really a lot. And then we had other outbreaks, and which caused that quite quickly, and we started a second wave. And this was all that started our second wave. So a few lessons learned. Okay, the young children were not the ones transmitting. So maybe in elementary school it's safer to open. And I agree with what Nick said about the hybrid model. I believe that's what should be in the end. But the youngsters, on the one hand, the teenagers, they're spreading much more the disease. And of course, they're not very sick, but we're very concerned about what happens with their parents, their grandparents, and their sick family members that might be at home, and they could transmit the disease to them. But on the other hand, I have to say that when we prohibited gatherings, they would still continue to make their end of the year parties, illegal end of the year parties, and we still continue to see outbreaks in this group. So, it's a problem with them. But one thing for sure, at least in teenagers, you cannot employ real social distancing. When they meet each other, they won't wear masks, and they won't keep social distancing. So it's complex. It's not, and I agree. You can't leave them in their houses all the time. So I'm more confident about opening schools for younger people, younger children. Also, I think it's more important for their parents to go back to work. The teenagers can stay at home, and the parents can still work. But with young children, it's really a problem. So it's some of the things that we learned here.
Thank you, Dr. Barkai. So I have one more question for you, actually, Dr. Barkai, which is, you wear many hats at Sheba. You talked about caring for the children who were admitted to Sheba, who tested positive for COVID. And then pre-COVID, you were the head of telemedicine services. So can you talk a little bit about how your telemedicine background really segued into your work with the children who tested positive with COVID, and how the children reacted to using telemedicine?
So definitely the children, it's easier for children to use electronic devices to communicate with video, to even use gaming. We even used the VR in some of the patients that were hospitalized in the beginning. So it's easier for them. I do think that I kind of mixed both my jobs, because in the beginning I really understood how important it was to talk to the children before they came to the hospital, to explain to them about the setting, the situation. In Israel, in the beginning, the patients that came to the hospital, they were brought in by ambulances with the people wearing all these white things. And it was really in the beginning, they didn't know what they were coming to. So I took care of talking by phone or by video with the kids and their parents, if they were old enough, before they arrived to the hospital, before the ambulance came. We knew who was coming to the hospital, and I would explain a little bit. First of all, make them know me, which I was going to be their physician. So we met before, at least virtually, and explaining to them what's going to happen and how it's going to be. And we tried to arrange the rooms for them, especially for the kids, with things to play with nice things for kids. So we really had the opportunity, since it was the first ones and we were not flooded by hundreds of cases, we had the time to prepare for more nice things for them as kids, and to prepare the place for them to be with their parents according to the ages. So I think I use both my abilities to help them deal with it.
Great. Dr. Altman, we have a question for you about tips for parents. So we have a lot of parents who are trying to juggle working from home, but also being a teacher. What do you say to those parents who just can't catch a break these days at home, who are trying to balance it all?
It's really challenging. I mean, I think, that's what happens. We're in a national, and global crisis here with the pandemic. And I think everybody is, working 24/7 and really, stretched so thin. I know when this all happened, my kids were home, and my husband is working from home, but also was helping my youngest do a preschool Zoom, because I was at the office 12 hours a day, dealing with not only patients, but all the COVID, stuff going on in our area. And so I think it's going to take all of us, to work together. I think different communities are coming up with different options. One of the things, though, that I really want to caution everybody about is I keep hearing a lot of parents saying, oh, we're forming this learning pod. Oh, we're hiring this teacher. I even see in a lot of LA public schools, and I wanted to ask Nick this, they're opening up their doors and saying, pay us, we'll give your kid childcare, come on your computer and do Zoom. And I'm wondering, how are these all safer than actually opening up a school in person? And so I think, the same criteria really applies to anything that you're doing. You need to make sure you're taking precautions to keep the virus out, to decrease transmission, to be able to diagnose and contact trace. And so, although I understand that families have to do, what's best for them, and we all have to be creative with these solutions, I think you can't assume that you're not at risk just because you live outside of LA. And you really need to be careful and make sure that you have somebody that knows exactly what needs to be done to decrease the transmission and what to do if somebody is diagnosed. And so I am concerned that in some of these childcare settings, it's not going to be as safe. And that's where we're going to see outbreaks. And that is going to, hurt all of us. And I'm happy to answer any specifics about those situations and scenarios and how to do it. I mean, I've worked with preschools, I've worked with pods, I've worked with community centers, I've worked with schools, and every situation is unique. And I think it's perfectly possible to have any of those situations be safe, or as safe as possible. But it's challenging. And, sometimes I wonder if we all just didn't work together to open up the community schools in a hybrid fashion, if it wouldn't be better for, for each community. But again, it depends. I saw, comments in the chat about the governor. I don't think the governor was wrong. I think, he did what was best looking at the numbers in our state. And I understand we all live here and we're all responsible, even if I live an hour from LA where there are higher numbers. But I do think that, in many communities, we do need to open up in some fashion to help these families that just can't do it all. They can't work from home. They can't leave their kids home alone, even if they have middle and high schoolers, because those kids won't be on the computer Zooming with their class. They're going to be off doing other things, as Dr. Barkai mentioned. In that age group, some will follow the rules and pay attention, and some won't. In one of the programs that I've been running here, we've had amazing success with kids of all ages following the rules from K up through 12. And but that doesn't happen everywhere. It really depends on the community.
Great. So there's been no doubt that the virus has led to a lot of changes in terms of the socialization of our children and really the daily routines. So I'll throw this one out to all three of our panelists, but how important is it for children to stay social? And do you have any recommendations to ensure that the proper socialization of our kids? So let's start with Dr. Barkai.
I'm sorry, you were muted. I didn't hear the end of your question.
How do we ensure that our kids are staying social with all the screen time? And maybe if you want to talk about the effects of maybe some long-term effects of all this screen time as well.
I'm sure that all of this is affecting not only their mental health, but also their physical health. Children will sit down a lot of hours, not move, not see the sun, not do a lot of sports. And it's really, really challenging because we want to say, get out of the houses, play outside, do some physical activity. And we really don't want to see a world in which everyone does it in his own room by himself through Zoom. This is not the world that we want to see. Unfortunately, these times, it's really, really difficult. What I think, my opinion regarding Israel at the moment now is what we should mostly do is to protect our elderly and to protect the sick people. So the children can meet in small groups, maybe, or have their little capsules of a few mates that they meet again and again, or a few families together. Of course, it's really good to have some more family time together and maybe go hiking with the family. And do physical activity with the family, but the social events are also very important for them. So I suppose that the best thing to do is just to be, with a small group of people that you meet all the time. And if someone gets ill, you're still in your capsules, and then really, really care about the precautions when you're meeting the grandparents, the sick people. Really, really do your best to wear masks and do physical distancing. If you do that, the risk is much lesser. So I think this is the most important thing to do.
So yeah, I think I agree with everything you said. And again, it's so interesting and different how this is affecting all the different communities and all the different families. So while I do have many families that are just having a really hard time being home, whether it's parents lost their jobs, parents are working from home, kids are having trouble learning on the screens, kids are sad, they're bored, they're missing their friends. I also have families where this time together has really decreased their stress, where they've learned how to bond and come together and communicate as a family. And for some families, even though a smaller portion, I think this 6 months has really actually helped them grow together as a family. So I think, my take home message for all of you, and I know that all of you on this call are here because you have time and you do want to do what's best for your kids, is I would say, the most important thing you can do is spend time together as a family. When this is all over, what your kids aren't going to remember, all the details about COVID-19 and coronavirus. What they're going to remember is how they felt during this time. Did they feel loved? Did they feel safe? Did they feel secure? And they remember the memories that they spent with their family. All those evenings in the backyard, playing soccer, assuming you have a backyard. the camping trips that you took because there was nothing else you could do for family vacation, all those family meals you had. I have so many families that are now actually sitting down and having meals together. They're talking together. They're having family movie night. They're going for family walks. And I think in some ways we are all learning so much about, you know, what we really need as a family and what's best for our own family and our kids. And of course it does, you know, vary day to day and change. And but I think the most important thing you can do right now is really just spend time with your kids and talk to them and listen to them and reassure them and let them know that you're there for them. And they're going to end up okay after all of this.
Well, I'll just add one. It's been so great to learn from my fellow panelists here. And I wish we had more time. There have been so many great questions in the chat too. And so maybe at the end we can share contact information, because I'd be happy to continue this conversation. I think it's so important for kids to be social. And so I've really come to stop calling it social distancing, but just physical distancing. You know, and I think that words matter. And I think we want kids to realize that they need to be social at this time. So, you know, I'll echo everything that's been said. We did a lot of virtual town halls for families over the last few months. Fridays, we did family-specific programming, cooking classes and magic show and art class. And then on Wednesdays, we did town hall conversations for families. And if you go to our Facebook page, we have one on mental health and resilience. And there are some great actually tips and tricks for parents on conflict de-escalation and just kind of how to all survive in this new reality. You know, I think also to Dr. Altman's question, we in addition to running 1,000 schools, you know, we lease our facilities. And so I think one of the things you were getting at with this, the fee for service program, is there are nonprofit providers like STAR, for example, or the YMCA that do have different regulatory frameworks and also different ideas about what's safe here. And so one of the things we're trying to balance is how do we let those nonprofits use our facilities the way they do in typical times, but also make sure that we're not compromising health and safety. We're also looking at our, you know, one of my priorities since joining the board has been opening up our schools on nights and weekends to the community as parks and as social spaces. And so we're also looking at, you know, can we let kids come and do social distance soccer where they're just passing the ball, but not interacting with another? Can we do basketball where everyone has their own ball? Can we do tennis, which, you know, is maybe one of the more socially distant sports? And so we're looking at ways to get kids on campus to move, for families to be able to have outlets, and think about how we can meet the needs of families during this time. I'll also think, or just mention, we're also looking at childcare options, because when we do eventually move into a hybrid model, you know, if that means that some groups of students are coming Monday, Wednesday, and another group is coming Tuesday, Thursday, we know that the days where kids aren't in school, they still may need an option if their parents are working. And so we're working with the county right now, private facilities, synagogues, churches, about leasing spaces where kids could do their remote learning and have a childcare option. We're also really doubling down on tutoring, individual tutoring, because, you know, I think that the pod the idea that is emerging is a really creative one. And for families that can afford to hire that other teacher or have those group of families that have the same schedule, it's a great option. But we know that at least 80% of our families don't have that option. And so rather than saying you can't have your pod, you know, I'm a big believer in parental choice and letting parents make the decisions that are right for them. We're just trying to figure out, if the pod is like the private option where you hire that extra teacher, how do we create the public option? And that's where we're looking at tutoring. And we have actually a lot of college kids who have volunteered their time so that we can give students the one-on-one, both academic and emotional support over the next few weeks and months.
Thanks, Nick. We actually have another question for you. What is your suggestion for private schools that typically have smaller class sizes than public schools?
Yeah, so it's a good question. And I think, you know, we have been coordinating with private schools, you know, both given that I went to Curtis and then Harvard Westlake, and, you know, have former colleagues and friends there, but we've also just been trying to share best practices. And I really think this has been a time when a lot of the divides between district and charter and private and parochial, that people are really just kind of dropping those old, battle lines and just trying to support students. So we've been sharing best practices and trying to learn from those schools. I think that they, we have larger class sizes, and so we're kind of forced to do in the hybrid model, the every other day, or some kids come in the morning, some come in the afternoon. We've also been looking at contingencies where, as some of our experts have said, it's elementary school students, younger students aren't maybe as risk prone. And so could we keep high school kids at home and do online learning and use high school campuses for elementary school students so that we could spread them out, and looking at those options. I think for private schools that have smaller class sizes, it's actually easier for them to kind of to social distance in the first place. I know Harvard Westlake, for example, has already walked their campuses and put desks 6 feet apart and figured out what to do there. I think that the challenge that private schools have now is just the governor's guidance applies to them as well. I agree with Dr. Altman. I understand where he was coming from, but I also think that there is some local control here. And even within LA Unified, we have different regions that may be opening on different timelines. And we've been running a lot of different contingencies about what happens if there's a case at Topanga Elementary School, where everyone really lives in that community, versus, let's say, Hamilton High School, where there are kids from 100 different zip codes. And so it's not, if there's a positive case, which is going to be an inevitability, and I think we learned from Dr. Parquet in Israel, that when you open schools, there's going to be positive cases. So it's about kind of how to mitigate the risk. And if we have a case, it's not going to be the entire district closes. It's going to be, how do we look at those schools? And so I think private schools that are kind of those self-contained units have more flexibility there as well.
Great. So in closing, we're going to ask each of our panelists to share any helpful tips that they want to leave our participants with, or any last minute opportunities to bring up something that might not have been covered in our discussion. So we'll start with Dr. Altman, go to Dr. Barkai, and then close with Nick.
Sure. So one thing that I wanted to bring up, because this comes up when I talk to the schools and communities and the parents, and it's mainly about testing and access to healthcare. I think if there's any year where it's really important to make sure that your family has a medical home, a pediatrician that is available for you, that can test you when needed, that can see your child and give you guidance on return to school, even if it's virtual, this is the year that you need it. And although the state as a whole and LA County as a whole is having problems with testing and contact tracing, there are many labs that doctors can contract with. I have contracts with 7 different labs right now to get testing for my patients, for my community, for the schools in my area. It's not that hard when you know how to navigate the system. And contact tracing, anyone can know how to contact trace. So I recommend that you all go to Coursera, Johns Hopkins class. It's free, 5 hours. I've already had 7 people at my kids' school get certified in contact tracing, 3 at our temple. And, we're going to need help contact tracing, because that's really going to be the key when it is safe to open and when we do phased reopen. And I think in many areas around LA, if they let us open, we can do it safely. But unfortunately, it's not every area, and it's going to depend on the community. I think my take-home message for all of you is really that there's no one right or wrong answer. You have to decide what's best for your family and your kids. And some kids can learn great online, and some just can't. Some can't learn from screens, and they would benefit from the opportunity to learn in person. Some families can't be home, and some can. And so I think, there's no judgment here. I think you should all have a conversation with your pediatrician. I do this all day long and really evaluate pros and cons, for each family of what situation is best. And, we're all going to get through this, and we're all going to be more resilient in the end. And I think the most important thing we can all do right now is just be there for our kids, and also teach them to distance, to wear a mask, to wash our hands. And if we do those 3 things, and everybody all together at the same time in Los Angeles and in the state of California and around the world did this, even for 4 weeks, we would see a huge difference in numbers. And then we would all be able to get back to whatever we feel is right and best for our family and our community.
So you just took what I wanted to say. What my first thing is more medical, is just education. I think education is so important about exactly these 3 things: wearing masks, washing hands, and so not social, physical distancing, as you said, Nick. So I think this is really the most important thing. As parent, I think you should do a lot of efforts to educate the kids that even when you're not around, that they should continue to explain how important it is, especially the masks. I don't know how it is down there in LA, but in Israel, I think we have a lot of problems in educating the population, especially the kids, about the importance of it and how much it can prevent infection, really. The other things I already said before is take care of the elderly and really be very, very strict about these things when you're meeting your elderly family members. And I agree with Dr. Altman. We'll finish with it and we'll be more resilient. And it's just a period it's going to go through, and we'll be stronger in the end. And another thing is just, it's a good opportunity to remind that before winter is coming, you should be really take care of having the flu vaccine, because the flu and COVID-19 will be an extra burden on the health system. So this is a good opportunity to remind you of this.
And that reminds me, Dr. Barquet, too, that we're seeing really historic lows in vaccination rates for students right now, because doctors' offices have been closed, because families have been nervous to go, understandably. And it just, outside of COVID, we still have challenges, as we've seen in regions like LA, around other diseases. And so I just encourage parents to, like Dr. Altman said, find your healthcare provider and still get those other vaccinations, because that will just compound the challenge. What I'd say is, echoing the advice that's been given, every parent needs to make the decision that's right for them. And you have my commitment as the school board member, for those of you in LA Unified or charter schools, that we're going to be working with you. I know large bureaucracies, you usually get a yes or no answer, but it's really important to me that we're going to have an online option for the entire year, that at the school level, when we have these hybrids, we'll be working with families to figure out what works for you. If you have your learning pod, we'll do all we can to kind of build the school schedule around your family so that we can really meet the needs of individual families. I'll also say that, I think this has really, like I mentioned earlier, exacerbated existing crises. And so I hope that there's a learning here, which is the challenge of large public school districts, the challenge of access to healthcare, of access to food. And I hope that that when things do get back to normal, which they will, and kids in particular are extremely resilient, that we don't forget the challenges here and do more kind of systemically, societally, as Jews, to figure out how to support our community here. When we have today in LA 600,000 family members coming to get food because they need it, that's not going to go away post a vaccine. And so let's make sure we're continuing to care for one another. And then I'll also just say, we talk a lot, especially with mental health, about self-care and being kind, but it's important that people be kind to themselves as well. There's no right way to go through this. Parents out there are wearing so many different hats. They're parents, they're working, they're teachers. And I just hope that everyone can kind of be easy on themselves, because like Dr. Altman said earlier, there are a lot of unintended silver linings of this time as a family. Appreciation just in my community for just going on walks and being outside in LA and spending time with our neighbors. And so we will get through it. We're in this together, apart, as I like to say at the district, but in this together. So thanks for this opportunity.
Thank you, Nick. Thank you, Dr. Barkai, and thank you, Dr. Altman, so much for being with us today. We learned a lot, and we're very appreciative of your time. In closing, I'd like to invite Denise Neuer-Eres of our San Fernando Valley chapter to share some final remarks.
Thank you. Wow, that was phenomenal. Thank you, guys. And I want to thank everyone for joining us this morning and supporting Sheba Medical Center. And really a special thanks to our expert panelists, Dr. Tanya Altman, Dr. Galia Barkai, and Nick Melvoin. It was really amazing to have all of you here with us, and we can't express how grateful we are for your time and your expertise and all that you've really given. And I think we can all agree that that was phenomenal, and there was so many amazing tips to get out of it. And even if it's, making sure that we're all sticking together and doing all those things that you mentioned as far as wearing our masks. And I love the distinction about the physical distance and making sure we wash our hands and just really trying to make a great environment for our kids, doing the best we can, coming together, and all the tips. It was really phenomenal. So thank you. And we also want to invite you to join us in our efforts in supporting Sheba Medical Center. It's a phenomenal organization. And, you know, as Molly's shared about all the research and all the wonderful things it has done for our world and for our community, one of my favorite parts about it is the humanitarian efforts. So if it's something that you would love to learn more about and get involved with, please feel free to contact Molly and Rachel at the Friends of Sheba office, and we'll make sure to make a link in an email, or you can look on the Facebook page, or in order to learn more about that. So thank you everybody so much. It was very, very meaningful and informational.
Have a great day. Have a great evening. Thank you, Denise. Thank you to our panelists.
Thank you.
Thanks, everyone. Stay
Bye.
safe.
Bye.